Good morning, guys. Today we have a new guest for our Rockaseo business conversation. I have a pleasure of having here Dr. Thiru. Hi, Dr. Thiru. Good morning.
Good morning, Gabriel.
Dr. Thiru has been working as a consultant dermatologist in NHS hospitals in Liverpool, North Wales, and Manchester since 2012, providing both community and hospital dermatology services. He has experience in treating acne, eczema, psoriasis, rosacea, and skin infections, and much more. Since 2015, you run your aesthetic practice, offering non-surgical cosmetic treatments with a focus on natural, balanced results. Today, we will start pretty much as usual, a bit of a background on your story so you can share with our listeners, how you started, perhaps how you moved to the UK, just to give it a bit of background here. Please, the floor is yours.
Okay, Gabriel. I'm a doctor since 1991, and then I graduated in India initially and moved to Singapore, where my father used to run a business. So I joined him, and then I started to work in an interesting shipping company where I have to go see the patients in the middle of the sea. So I used to travel for nearly 10 hours, 12 hours to go to a ship and look after sick patients there. So when I go there, I had an opportunity to see a lot of patients with skin problems. Oh my gosh, because they haven't got any access to the doctors because they're in the middle of the sea. And then as a little bit got interested with the amount of skin diseases I started to see in those patients. That made me to get more interested in skin diseases. So although I was a GP there, so I started to become more interested in dermatology and skin conditions where I, I decided to do dermatology as my specialty. Then so that was my first thing where it started, where why I want to do dermatology. And then I have to think, where should I do? Should I do it in Singapore or should I do it in somewhere else? And then I was doing a lot of research. There's one place came into my knowledge through my friends in the United Kingdom, where there's a very famous place called St. John's Institute of Dermatology in London, which is which has been there since 1920s. So I thought I would go there to learn. So I went and joined Master of Science in Dermatology. So I did it for a year with my thesis and my dissertation, everything, and then I got a very good grade, passed in good first class and honors, and then I started to work in dermatology in the NHS hospital, where I started to work as a junior consultant, and then started to do my training further in UK, and then I started to work as a dermatologist from 2011.
Wow, thank you for the input there and the background. That's a super interesting story. So, we've been connected from a while now. I didn't know this bit about Singapore. So, it's quite a difference, but I think that was the beginning of your connection with people, right? Because I know you really like to connect with people and, understanding, helping them out. So, but from a ship to London, that must have been a bit change, right? Big change.
Of course, it's a drastic change. Have to make a major decision to leave my family there, and then I have to come here to get my training done. But my gosh, I don't regret it now because I've made my journey, and then I've learned what is dermatology, and there is so many things I've learned over the years. And then from NHS, I started to do some community work as well, where community work means in NHS in UK now, the hospitals shifting care from the hospital to the community. So there's lots of patients being seen in the community. They don't need to go to the hospital because it's care close to your home. That's the concept they have in UK. And then when I started to do community care, and then I was thinking, okay, why not? I can have my own clinic so that I can help people in so many different things. Either it could be medical dermatology or it could be aesthetic dermatology where they want to improve their skin, or not just diseases where they want to improve the skin, where I can help them. So I started to develop interest in aesthetic dermatology. Then I did a course, like a diploma in aesthetic dermatology through American Academy of Dermatology about 9 years ago.
So for the next question, we're moving more into the business side of things with what you do. So why do you think it's important to talk about healthcare and dermatology today applied to, let's say, a business? So it's two different things here. So one is how do you relate with patients, but at the same time, as a business, this is really growing, and I think it's difficult to strike a balance there.
That's a very good question, Gabriel. So I've been working for NHS since 1999, but I'm doing dermatology since 2011. So what I've learned is COVID has put a lot of pressure on NHS health system. That made the waiting list gone a bit longer. So I thought, okay, because I'm doing community dermatology, why can't I have my own clinic and help the patients who are waiting to be seen in NHS? So that's my first thought. When it when I started my private practice in 2015, where I started slowly, and then since 2020 it's picked up quite a bit because people have been waiting to see the NHS hospitals because of the long waiting list, and they started to access. So I have to think differently. Okay, now I'm doing my private practice, how I'm going to do it in a, because working in NHS hospital is completely different from doing a private practice, where it's a different set of skills you need, which I started to learn and gradually, where you need to have your manager, you have to have your booking team, and you have to have a customer relation team, which is quite unique to have a private practice in dermatology, where you have to show how good you are and how can you help them to make sure you are the right person to see them and help them.
What you mentioned makes perfect sense. I mean, that is the shift from, consultant practitioner to business owner effectively, where when you run your own business, you have to have all those things. But in the NHS, your previous setup, they were kind of already there, right? So they were working for you. And then there's a whole other host of things like the online visibility and other things, which is more competitive than ever these days. So I think also a lot has changed. So there is more competition out there. So that also adds to the complexity. And we have so many solutions as well, which is at time confusing. So this is also what I do for other, business owners. So I help them going through these things. Thank you for the view. For our next point, this I wanted to touch on. We touched a little bit on this. So from doctor to business owner, essentially, there are surely things that were, expected running a business. But was there anything, that surprised you the most, and some skills you have to learn, and maybe something you underestimated at the beginning?
Quite striking thing which I knew when I started to have my own practice is I have to need more about social media. I need to know more about marketing. Those things are very important. It's not only that you're not advertising yourself. Of course, you are letting the the clients and patients know that what you can do, what you're good at it. So I think it's a good thing. If I want to see somebody, a private dermatologist, I would like to know what their qualifications, and how can they help me, and what is their expertise. So I have to fulfill all those in order to make sure the patients trust me and come to me and get managed by me.
Let's see some maybe real world examples, some concrete situations. So when you experience working with new patients, and this you can, talk about maybe your process a little bit. Where do you think you make the difference, compared to other dermatologists? I know as a plug for you, but because I've known you for a while, so I wanted our listeners to hear also from you.
Okay, the one thing I do with my patients which I don't think any of the dermatologists would do, I give personal care. That means, what it means me, they can contact me directly. They don't need to go through my secretary or my receptionist. They can contact me directly, which I try to answer to them as soon as possible, if not within a minute. So, that is the major thing I'm concentrating on my patients, uh, where I should provide a very good service. Whenever they need me, I should be available. Of course, within my professional limitations, but that's something I strive to achieve in my practice.
Yeah. So essentially, the trust and is super important for you. And I would say that this is some very important aspect these days, where also there's a lot of information, maybe too much information out there. I think people had a lack of trust, especially in the last 3 to 4 years, especially informations we found online. So knowing that someone will come see you and they have the trust and connection plus your availability in time is great. Many times people go to doctors, or even someone asks you to go to your dentist, and you have the feeling that sometimes they're just brushing you off, if I'm honest. So regardless of how much they charge you, or you go to your chiropractor, essentially. And there are, I would say, some, but it's more the exception than the norm, that someone will really put in the time. So I think that's something quite remarkable you're doing, and I would say do your best, if I can give a tip, to maintain this. The difficulty then, we can connect to a business point here, will be when you scale up and business will grow. How are you going to manage this? Because it's not an easy one.
You're spot on. Where sometimes when your business grows on, because I can do it for 30, 40, 50 patients, and after that is going to be very difficult for you. Uh, but I think it's still possible, because you can still give some time, an hour in a day, to write emails, and then you can always tell them, if I'm not available, please leave a text, and then I will get back to you as soon as possible, or leave an email and then I get back to you as soon as possible. Still, you can do it no matter how many you have. You can do it as many you want. I think it's still possible, because I'm quick. Um, uh, i i normally figure out what is the issue within seconds, reading their concern, and then I can answer to them as soon as possible, which I can.
Yeah. And I mean, yeah, with the scaling, because oftentimes businesses have scaling issues, in fact. They say when you reach a certain threshold, and this is the different by business, everything breaks. I used to work for this agency a while back, and they said when you reach this critical mass of clients or this much revenue, and if you don't have strong processes in place, everything breaks, because then you cannot, for instance, send invoices, you cannot get back to patients, you cannot book appointments. So this is something that is also important, that there are good solutions out there. For example, booking systems, for automations, and people can book appointments on their phone, and then you get it straight in your calendar, things like that. um, and I know it's confusing sometimes, so that's part of the growth there. But are you planning to grow in the team as well?
Course, you need to have. I realize that you need to have a booking team, and you need to have a customer relation team to support the patients initially before they get come to me. I think that's very important, actually. You're absolutely right that I need to have a process, or a system in place for the patients to access me easily.
Our listeners, I know we have a different audience here. Maybe some examples for, let's say, the most popular. I know we can talk about this for hours with you about this, but the most common questions people ask about dermatology, right? Is it aesthetics, problems, and then maybe if we can give some tips. I know this is, of course, your area. We want people to come see you, but I think this will be interesting.
I mean, dermatology is a big specialty where you can have medical problems. So, for example, it's called medical dermatology, where people can have skin diseases, like ranging from eczema, psoriasis. People can have acne. So they're all medical problems. And then if you come to surgical, for example, patients say that, "Oh, I got this lump or a cyst." That's a common question I hear from patients. Doctor, I got a lump. Can you remove it for me? Of course. So that's part of dermatology as well. And of course, there are some things. sometimes can be benign, which is not cancerous, and some lumps are cancerous. So obviously, this can be assessed only after I've seen the patient and then advise them on what is the right procedure for them. So surgical procedure ranging from simple excision to shave, curette. There are different procedures we could do for lumps and bumps. And obviously, the third part is where people say, Doctor, I got a lot of pores on my face. Can you help me? So that comes to your aesthetic dermatology. So dermatology is a very interesting, ranging from medical, surgical, aesthetic. So patient can have acne, patient can have pores or wrinkles. They want to get that sorted. There's so many things you can do in dermatology that makes the dermatology is very unique and interesting.
Do you think people understand the issues easily, or they will tell you, okay, I understand, thank you, doc, and then they come back with more questions? That happens.
Patients started to understand more now than I would say a few years ago. Probably, I guess, is due to the information out there in the and then the social media, which a lot of people knows what they're talking about, compared to what I've seen 7, 8 years ago. So that makes me interesting. So you got to be well aware with the current updates to keep up with the patient. That's what I realized. That's very interesting.
Yeah. At the same time, interesting point here. We can connect to something. So much information, true, but also can be dangerous, right? Because I think one risk we have with what we find online, even if you ask the AI these days, people might assume things and then they don't have the of experience. Because, well, it's true that it will tell you, hey, I cannot give you medical advice, etc., but it will still try to answer you back. And I think that's the time where someone with your experience makes a difference. Because maybe, oh, I saw this on the internet. Oh, someone said so and so. And then you go, no, 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 that's not how it is. This probably happens as well, right? How do you think this change in dermatology? And is it difficult to keep up? Like there's new things, trends and techniques coming out. And I know you try to stay up to date, of course. But do you think is it too much? Like in the tech world we have, it's too much sometimes.
I think the dermatology has come quite a bit recently, although there's not much changes in medical dermatology. Although there are new drugs developing for certain conditions like eczema, psoriasis, what we call the new drug called biologics. So there's a lot of improvement. Yeah, I mean, 10 years ago, 15 years ago, we had only limited drugs to treat eczema and psoriasis. But now we have got an array of biologics which change patients' lives. They literally become normal people, like they never got a skin disease. So dermatology has moved on quite a bit recently, and there's so many things available. And coming to the aesthetic side, there's so many laser machines out there which we can treat some for cosmetic reason without giving any scar, without putting your knife on the skin. We can treat so many conditions with the laser. So that's why it's very important for us to go. I mean, in fact, I have to go to a meeting every 4 months to keep myself updated on what is out there to help dermatology patients.
I had another point connected. So, with the overall well-being of patients, do you think there is a connection with, let's say, the food, your diet for how your skin looks? Because I've read this, and then people say, "Hey, if you eat this food, your skin can improve and stuff." Is this like one of those things, myth or reality, or maybe for certain people they're prone to have something regardless, let's say they eat good or not?
That's a very good question, Gabriel. I think, or even we have been taught in dermatology, that there is no connection to food in the past. But I certainly believe a good food, good nutrition, and good hydration makes your skin a lot better. So let's say people always believe chocolate or milk make your acne worse. A lot of patients, I've heard a lot of patients saying that, but doctors never say, "Oh, it's a myth." But I think skin nutrition and skin diseases, there is a strong relationship where if you look after your skin, with a good diet, less sugar, good hydration, less sun exposure, it makes your skin a lot better, and it makes you aging a little bit slowly rather than quite quickly.
And also, wow, I'm having connections here. Is it great? I like this where we're going here. And also, if you keep your diet in check, you might need to see less a doctor. I know not for good for you in this case, but it's for the well-being of someone, right? So it does make a difference here. This was a great topic, and I think also there is that thinking these days that you can solve everything with the pharmaceuticals. And I know we can have different opinions here, but for me, a strong point is take good care of yourself, try to eat as good as you can, and then you will not need to see the doctor too much, and you will not need to take too much pharmaceuticals, because there is that thinking that we can quickly fix everything, like a quick patch for things. I have to say, especially from the American audience side of things, where they have drugs for everything, let's be honest. But people don't want to put in the time and sort the work to work on themselves and then improve their quality of life. What do you think of this?
I agree with you, Gab, there. Of course, medicine is not the answer for everything. First thing is, I always tell my patients and my family that health is wealth, which is, I always emphasize that word to everyone, with my friends and family and my patients. Where if you look after yourself, eating right food, good hydration, happy life, sleep well, and less sun exposure, I would say the final one, less sun exposure. I think a lot of people underestimate the sun exposure. Of course, sun exposure makes us happy because sun plays a big part, but you got to be careful. If you let have your skin too much sun, the skin will age. So it's important to be on the shade and to use regular sunscreen. Of course, you can enjoy the sun, but be in the shade and enjoy the sun.
Okay, doctor, I have a discussion point now. And again, we might have different opinions. Since a number of years, me and my wife, we've done some research on things. We like to keep things very healthy. So we no longer use any sun cream whatsoever. But I do have a really relatively dark complexion. I'm Italian. My wife is from Philippines, so we have quite, I would say, not super strong, but strongish skin. And normally, what we do is, let's say, we regulate ourselves. So we don't put anything on anymore, but we are conscious of how many hours of exposure we do, for example. So we're right now in Croatia, the sun is very strong in the summer. So I will not stay from, let's say, in the peak of the day, like, I don't know, from 2 p.m. to 4 p.m. out in the sun, and then feel extremely burned the next day, where sometimes we see tourists here going crazy and burning themselves, right? But we noticed that since removing the sun protection products, because let's be honest, they have some chemicals in it to deliver the protection. Actually, our health and skin tolerance to sun has improved. So how do you explain that? It's a bit weird. Though I know it's against the guidelines that they say use sunscreen. Maybe I'm putting you on the spot a little bit, but this is what we noticed, and also for boosting your vitamin D levels and stuff. So we actually try to do more exposure, but reasonable and sensible how much we do. That's what we try.
Okay, let's discuss with you an interesting thing. Vitamin D is important, right? So vitamin D is formed in our body by photosynthesis. That means photo means light, which is through your natural sunlight, UVA and UVB needed on the skin in order for the body to change into vitamin D. That's how our body produces vitamin D. So you need some sun exposure for your vitamin D, right? I think there are different things. Like for example, we call that as type 1 skin, where light color skin, people who burn very easily. So they we where people who have like little bit darker skin can have more melanin and they need more vitamin D. In fact, I mean, there's another day for us to discuss. So, of course, when you apply the sunscreen, question to answer your question, when you apply the sunscreen, it delays the absorption of the vitamin D, and it reduces the absorption of vitamin D. So you got to take external vitamin D, or it's quite, we still need to answer that question whether sunscreen really reduces vitamin D, or because at the moment the guideline says you have to use sunscreen in order to prevent skin cancers, but I think the jury is still out.
Well, again, we're not using, other than saving some money in the summer, it's more that we feel actually really good. And I mean, we supplement with other things, vitamin C and etc. But because vitamin D helps with your immunity as well. So I have to be honest, we've been no longer sick since years now after changing a few things, having higher vitamin C levels. But still, I think this is also case by case basis. You cannot say this will work with everybody as well because people have different skin types. So I'm not recommending against not using sunscreen here. I'm just saying our personal experience, we no longer use it, but it works for our personal situation. Thank you for that. Okay, we have our last question before the closing. What excites you the most about the future of dermatology or private clinics in general?
I've seen there are so many clinics come about in my region. Obviously, where they have the same thought, where the NHS has a bit long waiting list, so people try to access privately to be seen and sorted. Um, so there are competitions out there, and I feel that you got to be updated with the trend. Uh, what is the competition out there for your business, and how you can improve the service through a better system to scale appropriately and to improve.
For our listeners, where can people find you, or how can people get in touch with you?
People in Liverpool or Manchester even Northwest, I can go to different clinics. Check www.specialistskincenter.com. That's my website. Or they can ring me on my personal mobile, which is 07970 where I will answer as soon as possible. Or they can link it to my Instagram account.
And we will put your contacts down in the description. On one last question on this. Do you also see like do you get international queries, or I mean you're based in the UK obviously, but can someone from abroad also contact you? Of course, they will have to come in person in the UK obviously, but what if someone is based elsewhere, let's say in Europe or US?
I've got patients who are calling from Ireland, Spain, where not for themselves actually, because they would have seen me because their daughters or sons who are living in UK needing a dermatology opinion, where I've got over the years that patients ring from other countries uh, to be seen quicker in my area. So there are a couple of patients which I've had from Ireland and Spain as well, for them to come at a certain point of time in the month, and then whether I'll be available to see them at the time.
What if someone wanted a Zoom consultation? Could you do that? It's difficult, probably.
Of course, that's something I'm trying to develop, where I need to have a Zoom consultation or video consultation, which I can do, but it need to be probably need to have a setup in my system. I try to get it as soon as I can.
So this is, I think, a good tip. So if there's someone watching and you're not based in the UK, I mean, technical difficulties aside, the doctor here is also open for other, remote consultations, and of course, it will not be the same experience. But I think for diagnosis, I mean, these days webcams are good, so you are able to see skin situations, obviously.
With a good video consultation, you can able to diagnose most of the diseases. So it is entirely possible to have a remote or virtual consultation where we can recommend what are the treatment they need to sort their skin.
Fantastic. So maybe this is something new we have to push more on your website. Okay, great. It was a pleasure having you today on our channel on Rock SEO, Dr. Thiru. I have one very final question. If there is any guest you can recommend or you can think of we should have on our channel, who would that be?
My colleague, which I used to, is a general practitioner, is Dr. Arun Ghosh. Is a owner of a very popular GP practice in Liverpool called Ghosh Medical Group. So something you would be interested to do it for you.
That's great. That will be another interesting episode. Well, thank you so much. It was a pleasure having you here. And for your dermatologist needs, please check out specialistskincenter.com. Thank you, guys.
Thank you, Gab.